Now this morning, congestive heart failure is a condition that results in fluid buildup in the lungs and body. Symptoms can include swelling in the legs and progressive shortness of breath, and it can also significantly reduce quality of life.
And the symptoms can sometimes be hard to get under control, but an implantable heart failure monitor can help some patients get their lives back.
In early 2019, Jauhn was diagnosed with congestive heart failure and was put on water pills and other medicines to control it. But they weren't working, and the excess fluid was making him ill.
I just feel icky. I can't do anything. If I go to the grocery store, that wipes me out for the day. I had no hope.
So Jauhn went to Aurora BayCare Medical Center's Comprehensive Heart Failure Clinic, which takes a team approach for treatment. It includes doctors, nurse practitioners, heart nurses, and more.
So all of us together, I think, is how it works the best.
They've been with me every step of the way.
Interventional cardiologist Dr. Matthew Schmidt prescribed the standard treatment for congestive heart failure.
Treating them with medication and diet advice and monitoring salt in the diet.
Some days Jauhn felt better, but his symptoms persisted.
I just feel sick, and I couldn't breathe. If I lay down at night in bed, I felt like I was drowning.
He had been hospitalized a number of times for heart failure symptoms.
So Dr. Schmidt's team suggested CardioMEMS. First, a heart failure monitor is implanted into the pulmonary artery to measure his blood pressure around the clock. Dr. Schmidt performed Jahn's procedure last October.
And essentially what it is it's a pressure monitor, and it sits in one of the lung arteries. We put it in through the groin, through the vein. Once
a day, Jauhn fires up his CardioMEMS pillow at home, lies down, and pushes a button.
So the transmitter is in that pillow that you lay on, and that actually sends a signal to the device in the body, and it reads the pressure.
Transmission successful.
And within a couple of minutes, that information is sent back to the doctor's team electronically.
Every day we take a reading, and that reading gives us the pressure in the lungs, which is used as a correlation for how much fluid is in the body, either too much or too little.
Where it is evaluated by the team.
If the pressures increase, that suggests extra volume or extra fluid. So that's the number we're watching, and if we see that number go up, then we know there's too much fluid, and then we adjust the medicine.
Dr. Schmidt says it's a way to stay on top of any pressure changes before symptoms occur, and Jauhn ends up back in the hospital.
Because sometimes the readings change before patients have symptoms.
Dr. Schmidt says studies have shown patients who are using CardioMEMS have had less hospitalizations. Jauhn hasn't been back to the emergency room since or feeling ill.
I could do stuff now. I could do laundry. I could go to the grocery store. This thing has been a lifesaver. Yes, I do have hope for a long life. I want to enjoy my grandkids.
Heart failure patients must meet certain criteria to be eligible for CardioMEMS, and like every surgery or procedure, there are risks involved, so you should talk to your doctor. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com.
Well,